All right, for our titer, we're working with a patient who has Panner's disease. So Panner's disease, what is typically done is you're immobilized for a period of time, resting, you're not engaging back in sports. But one effect that it can have if you do have Panner's disease is you can develop osteochondritis, especially between the capitulum and then the radius. So what we looked at was a case report of an individual she was a gymnast and she developed osteochondritis of the arm. And what they did for their intervention is they made their own protocol and broke it down into 2 phases, so phase 1 and phase 2. Phase 1 worked more on pain management, protecting the elbow, regaining range of motion, starting to strengthen, leg strengthening, then 2 of the muscles here. And then phase 2, once they decreased their pain, gained back range of motion, was more of a dynamic interventions then, specifying on her sport, working on that joint loading capacity, and then progressing that strengthening and conditioning of the arm. So what we're going to show today is the mobilizations that they've used. So they did a grade 1, grade 2 mobilization for pain control, and then grade 3 and 4 then to help work on that range of motion. So what they would do is with osteochondritis, Panner's disease, they're going to be starting to limit an extension. So with our roll and slide rule, we know that we have a concave moving on a convex, so it's going to be roll and slide in the same direction. So we're going to be doing a posterior mobilization going down here to regain that motion and help with pain control there. So what they did was they'd start off with the grade 1, grade 2. So we're just doing that to work on pain control for a minute, take a little bit of a break, then come back in, do a grade 3, 4 to help with that range of motion. So with this one, you'll have your patient's arm here. You're going to want to stabilize then that humerus here, making sure that doesn't move. The tricky part to remember too with this radius, there is a lot of tissue here, so you're going to move that tissue then out of the way. If you're pushing this way, you're just putting all of that tissue right back on that radial head, so you want to push away here. One thing also to just talk with your patient, make sure that it's not too painful for them, as this can be a tender spot for people, especially when they come in with Panner's disease or osteochondritis. So we're going to stabilize that arm. You're going to find that radial head. Make sure you're really close to the joint line here. We're going to move that fascia. We're just doing a simple grade 1, grade 2 right now. So we'll give them a little bit of a break then to reassess, ask them how they're doing, and then we'd come back here, stabilizing that humerus, moving that fascia, moving the tissue, moving the muscle away. And now we're going to get into that grade 3. So once you've done that, then you can reassess for pain, range of motion. Again, they did this for 5 months, and the total protocol that they developed, it was a 10-month protocol. So having patients too with these individuals as well. With Panner's disease and osteochondritis, there is a high chance of them re-injuring. It is an overuse injury. So patient education is also important then as well. Thank you.